The Business of Benefits is your no BS, no sales guide to real solutions.
No gimmicks, just the truth about how to take control, transform your benefits, and care for your most valuable asset, your people.
If you're tired of the same old sales pitch and you're ready to rethink your benefits, this podcast is for you. The truth is out there. Are you ready to hear it?
Welcome to the Business of Benefits. Today we had on Chris Yarn, who is the CEO and founder of Walk On Clinic, which is a on-site mobile clinic used at the company's discretion of demand and timing to make sure employees have access to physicians when they need it. We've known Chris for a long time. Back when he was starting the Walk On Clinic, it's been amazing to see the concept grow. It's something we've used in our business and for our employer groups, and we're starting to see that change in how he's using it as more of a direct primary care model, which is really nice and helpful. Makes a lot of sense when you compare it to a DPC model. Chris is also going to share a little bit about his personal health story and journey that he took this year on cancer and recovering from that, which is really heartfelt, really reinforces kind of the importance of early detection, which I think goes coincidentally right along with his model. So without further ado, Chris Yarn.
All right, we're back again today. This is The Business of Benefits, and we've got a really good episode today. I am so excited. We've got Chris Yarn, CEO and founder of the Walk On Clinic, and also a longtime friend. Thank you for being here.
Thanks for having me, both you two. Yeah. I'm excited to be here.
It's good to see you.
Good to see you guys.
So Donovan and I were thinking the other day, we're like, man, we've known Chris a long ass time.
Well, let's be honest. You knew Frank before you knew Chris. I mean, pretty much most of the benefits industry doesn't know who the hell Chris Yarn is, but they all know Frank Mike Droppa. So
that is true.
You know,
Chris has a couple personalities, which we will get into.
Right. That's right.
I don't even want to ask your wife how many you actually have, but
yeah.
Just kidding. So when was it that we first met Chris? That was a minute ago.
It's got to be 8 years ago or so.
You were one of the first people.
It's got to be. I think you had recently founded the Walk On Clinic.
Yeah. So I was like 2017, probably 2018.
Yeah, sounds about right.
When it was still Frankenstein's. I don't know what bar it is now. Is it still Frankenstein's?
No, that is long gone.
It's a
downtown
pizza
Orlando.
place.
Okay.
It's failed like everything else.
In downtown Orlando. is having its struggles.
Every time we come down here, we're like, wow, it's more of a wasteland than the last time I left. Like, it's incredible.
Yeah.
They're not.
Yeah. That Bullet Bar's still doing good.
They're not doing it.
Buddy Rogers running that one. He's doing good with it. But that was the first time we sat down, right? I think on LinkedIn.
Yeah,
right?
I think you had seen our website and
you
were like,
that's right.
Fiduciary.
Yep. Fiduciary. I'm like, finally.
It's about time.
Yes.
Right?
Yeah. I was like an agency that's talking about fiduciary responsibility. I really love the brand. And we got together and sat down. And I think a couple weeks later, you were at Benefits Pro.
Yeah. You know what's funny about that website? So we were a registered investment advisory, right?
Okay.
So licensed fiduciary. All I did was I changed the homepage and it used to say fiduciary plus financial advisor.
Okay.
And for like a year, I just changed it. I was like, when I found okay, this is what I need to do. It just said fiduciary plus employee benefits.
Nice.
But if you went through the rest of it, I didn't have time to do it yet. I'm like, all right, well, this is the market I have to serve. Yeah. And I think that's the time you saw it.
Yeah.
Well, and it wasn't too long after that COVID happened, and we ended up bringing Walk On out to a couple clients with the vaccines, and you guys were, instrumental, and you were all over the news, getting all sorts of press.
Yep.
Why don't we kind of catch everybody up with what Walk On Clinic is? Maybe that's a good place.
Or what about Frank?
Yeah, sure.
Oh. Let's start with Frank, actually.
Okay.
So I haven't seen Frank Mike Droppa.
Listen, I get messages all the time. Where are the parody videos?
Mm-hmm.
I think the last one I did was the last one really benefits industry related. I like to sing about the books that I think consultants should be reading in the marketplace, right? And so I did one for Marshall Allen's book, and I did one for Marty McCary's book, which he's got another one out now and just got named head of the FDA. And unfortunately, Marshall's no longer with us, but I got to do that video with both of them at the U-Powered conference.
That's right.
2 years ago. But yeah, the reason I haven't done any videos in pretty much all of 2024 is I've had my own little battle going, healthcare battle going. So, but It's done. Day before Thanksgiving, I finished my last chemotherapy round, which is good. But that's where, for all you benefits brokers out there, Frank hasn't done any videos because he's been at Moffitt Cancer Center for pretty much an entire year.
Frank's been healing.
Yeah. And so, but phenomenal, really unbelievable experience to, my company. We've sent a lot of patients, to different cancer centers and help them, detect things early. And if you've ever heard me speak at a conference, as well as saying, I'm very passionate about the business we're in. But yeah, it's one thing to, send patients to Moffitt, and then it's another one to be one and go through the whole process.
Yeah. Well, and just the work, I mean, your entire business model is on preventative care, and then for you to catch what you had so early. What parts of your story do you want to share with us today?
Yeah, no, I'm happy to share it. I mean, I think, I think the type, it was, super, super rare. Actually, I've got a good story to kind of tell you the typing to make people familiar with it. But when we got the biopsy done in January, it was it's something called Ewing's sarcoma. And so it's like, what the heck's Ewing's? And so Ewing's actually, hang on, I've got another hat I got to put on while I tell the story. So I'll tie it all together at the end, I promise. So, but my cousin writes me a letter, who's basically like my little brother, and he's just like, I mean, it was shocking to the whole family, obviously. So I've got an older brother, 2 younger sisters, 2 kids. I mean, it's this is where it's like, I love it's not personal. It's just healthcare. Like everything about healthcare is personal, right? Yeah. Like, I mean, we lost Marshall to something, in 2024, his situation. And it's like, it's shocking. But I'll get to the type of cancer, Ewing sarcoma. My cousin, the only thing I'm like, did Patrick Ewing have cancer that I missed, because that's the only, name I knew.
Right.
And so he writes me this letter, and he's like, it was a tumor in my ankle. And he says, he's like, the good news is, Patrick Ewing, he never won anything except when he had Michael Jordan. And he's like 89, found a way to lose, 90 found a way to lose, 91 Jordan beat him in all, every single one of those, playoffs. And so he nicknamed the tumor Patrick that was in my ankle. And was determined throughout the process to make sure Patrick didn't win anything this time either,
I love that.
But yeah, so that's why I put on the hat.
Yeah, that was my next question.
So the hat is, I can see Grove 23.
Yes, yeah.
Well, so Grove 23 is probably the most exclusive golf course next to Augusta.
Yeah, it's close.
It's something that takes more than money.
Yeah.
Like you also have to have fame or notoriety or a connection or something.
I'm not a member. I just know people, and
I know people who know people.
That's how I have the hat, or maybe I am a member,
Yeah.
No, I'm not on that.
We'll
list.
never know because we'll never see you there.
That's right.
We can't get there.
That's right.
So just tell people you're
Nobody
there.
can verify.
It was just inspiring. Like, I mean, if you grew up in the 90s and you're my age, I'm 42. It's like, I mean, so much of my childhood was just spent in my driveway playing basketball and like, being inspired by what Michael Jordan was doing and the Bulls and like the whole team, Sure. And so I think it's just made us very driven, as kids. And it's had an impact on me, for sure. So,
well, Chris, I feel
I'll take the hat off now. I had to tie it in,
Right.
I walked out, and I'll send you guys the video if you want to show it ringing the bell at Moffitt, but I walked out in my Jordans and
awesome.
And all that stuff. So
video. Hey. What? Thumbs up. You're done. I'm done.
It's me.
You graduated.
Right.
He's graduating.
Yeah.
Congratulations.
Right here.
Come on, baby. You got it.
Let's go! Okay.
Yeah, that one had me sobbing like a child. Yeah. I just want to say, you were really missed this year. Like, you obviously taking care of yourself and your health and your family, but I felt like everything was less without you in it. Like your presence is just so big, not even just Frank Mike Drop It, but you, right? Like I just want you to know like you were missed and you not being there was noticeable. And I'm just so happy. I know I've shared this with you one-on-one, like I'm so happy you're okay. And we just love you so much.
Me too. I love you guys, and I love being, part of this industry and helping families like mine, and like it's I think it's so easy when you're a benefits consultant and in this space to, do the right things, but also be very detached from what's actually happening to families.
Yes. Because you see the claims.
Yeah. Yeah.
You see cancer.
Oh, this guy's getting lasered, we'll put it on
Yeah.
this plan. And it's like, this guy's family and grandparents and children or, wife, they're going through turmoil right now. You don't know. It's a wild, wild ride,
I couldn't agree more. We opened up our team to that this year and kind of just gave them full authority to like help any of our clients' employees out on any kind of advocacy, anything they need, whether it's making appointments, getting connected with med management, second opinions, like that stuff is so much.
It's awesome. I mean, second opinions, so this cancer was 230 cases a year in the United States. Okay. It's a pediatric cancer, doesn't exist in adults and like at all. Right. So of course, what do you think I'm thinking? I'm like, well, they've got the typing wrong,
Right.
Sorry that this isn't right. They've got it wrong, but it was Moffitt who does secondary confirmation for a lot of these places. And actually Spencer Smith, Spencer, that is his last name,
Yeah.
right?
It is. Yeah.
Well, Tom the broker, he's got an alternate personality too.
Exactly.
So, but Spencer, I was talking to him and I told him for whatever reason, I felt compelled to like tell him, what was going on with me and why I hadn't done any videos. And he was standing in front of a cancer care booth at a conference and was like, this is going to freak you out. I'm standing in front of a cancer care booth. He's like, they can help you get it second typed. And I had heard about them, but I hadn't so I've been through that whole process and they helped me get it typed once I had the surgery. And then got second confirmation that was what it was. So it's a, bone cancer that was attached. And for anybody that was, to tell you kind of like how personal this story is to our space. I mean, if you were at UPowered when in Phoenix, when I was, doing the video for Marty McCary and Marshall Allen, I was limping around that conference. The Marriott was booked. So I stayed at the Marriott down the road. And I thought I had Achilles tendonitis. That was like one of the first times I can remember having an issue in my ankles. I didn't know I had Achilles tendonitis because I had a 10 centimeter tumor growing out of my bone, pushing on my Achilles, So it's like nobody did. And so I played tennis once a week. I do cold plunges, infrared sauna. So I think I did a lot of things naturally that were preventing the growth or spread of it, but it's just one of those things where, without, I'm the CEO of an on-site clinic company.
And you're healthy and you're young.
Yes. Yeah. Yeah.
You literally are like the epitome of a healthy lifestyle. And you have like, not to like share your stuff, but you've got good mental health. You've got good spiritual health. I know this about you. You are well-rounded.
Well, and I don't want to make a controversy of it or anything, but I do feel the need to say, because I'm asked frequently, did I do the vaccines or did I do the COVID shots, because it's a super rare pediatric cancer and there's been posts about turbo cancers and other things. And so, but I'll just, the reason that I did not do either of the shots is we were doing a ton of COVID testing and we also had antibody test kits as a company. So we were also for companies, we were testing if somebody had antibodies that, wanted to say neutral, like, well, this person got COVID naturally or this person didn't get the vaccine. And so we were just like, we're staying out of all of that. And it's, up to the person what they want to do.
Yeah.
But I got COVID twice and I had the antibodies because I still had the kits. And so I'm just like, well, I'm just going to wait and see how all this plays out. Like maybe I'll do it one day, but as long as I have the antibodies, I'm just going to hold on. That was just my personal decision. Yeah. But I'm just saying that because I think I've been asked so many times by people that have certain views.
Right. Do you think it was a vaccine?
They're like, well, did you do the shots? Is that how you got it? And it's like, no, I didn't, like I didn't, I got COVID twice. But
it did rain yesterday though.
Yes. Yeah.
That was definitely the shots.
Yeah. It could be. Yeah. I don't know, like I think there's just so much. It's like Dave Chappelle did a routine a while ago. It's like, we're in the age of spin, it's like, how do you even decipher or tell what is correct now? It's just so easy to convince somebody one way or the other of anything.
Yeah. I mean, we literally just saw that a day ago, right? That session on vaccines, like guys,
You got a Pfizer guy up there doing a whole session on what disinformation is and how to prevent it. And it's like, you've got countries suing them. And it's like, well, is it disinformation? Is it, I don't know. We'll see how it all shakes out. I don't want to turn this into I don't want to get the first podcast with the new thing banned and you guys get like kicked
Everybody
off YouTube.
hates us.
They're like, oh, they said the word vaccine and COVID. It's immediately stricken,
No more. So I guess one of my questions for you is, how much do you think like this absolutely crazy journey you've been through over the last year, how much do you feel like your experience and knowledge of the insurance industry and the healthcare delivery, right? Because we always talk about there being two systems at play. You've got the financing of healthcare, the insurance, and then you've got the delivery, and like your business is literally at the intersection. But now as somebody that's at the worst moment in your life going through that, how much did your expertise help you navigate it? Or was it still a shit show?
I'm just going to tell the truth.
Yeah.
And, Aetna's got a big claim on their hands. I'm on my wife's health plan.
Aren't you glad you're not on yours?
Yeah. So look, how do I say this? I've got a lot of knowledge in the space, obviously, right? But when you're going through something like this, and we do well financially, but it's the last thing you want to think about, and you've heard it, and so imagine you look at me and I've got every advantage in the world. I have, my wife's parents live where we live. My parents live where we live. Like, I've got a huge support system. I'm self-employed. Like, I could take the time off I needed to sleep, and, when my counts are low and couldn't move. And, you don't care. You're just like, and just so everybody knows, I ended up going to Moffitt. It wasn't my first choice. I'm somebody that's never been a huge fan of kind of like the barbaric way we've
Western
approached
conventional
cancer,
medicine,
right? For years, for many reasons, right? And it's just, chemotherapy works, but I know 2 people that have been to Moffitt that are no longer here. The only 2 people I know to Moffitt was my next door neighbor and a friend, and neither of them are with us anymore, right? A lot of people in the industry know Lester and know his story with his parents, and they both were Moffitt patients. And it's one of those things where, I was fortunate enough to be right near Clearwater, which is LifeWorks is a big naturopathic facility there. That's, Dana White's guy, Gary Brecka. That's where he gets his information from, that MD at that center. So I'm like, let me go see what their plan is. I just want to know what, the naturopathic plan is. And they still do chemotherapy there. They have a much different approach with diet and other things, but go through the process with them. And it's, they've never had a Ewing sarcoma in 22 years. They've done some sarcomas. They've never had a Ewing. So am I going to go be patient 0 with 2 kids and a wife? No. If I was on my own and I liked that approach, maybe I would have, but I just came to the decision like, well, let's bomb the body and hope my bone marrow and, me living a fairly healthy lifestyle will be able to withstand it.
Yeah.
And I'll be fine. And I'll get to the surgery, get the tumor out, get the bone out of the ankle. They took half of my fibula. And so that's, that's the decision I made. But you're talking to somebody that always was like, if I ever get cancer, I'll go, meditate and fast in a jungle for 20 days. I've done 5-day water fast, and I do like all the naturopathic stuff everybody sees online. Like, I do a lot of that stuff
daily.
Yeah. And so I'm not in perfect health. You guys have seen me drinking at conferences, but my point is, I'm one of you. If you're watching this, and we're in the same age range and we've been to conferences, it's just like, you saw me limping around U-Powered. I thought I had Achilles tendonitis. I was playing tennis 2 days a week. I'd have a little bit of swelling and it would go right away.
Such a discrete symptom. Like,
yeah,
who would ever think?
Yeah. I'm just wild. But fortunately for early detection and getting an MRI done, quickly, and my clinical director and my uncle, we were in Orlando when this all happened.
Right.
It blew up to the point where the swelling wasn't going down, and we thought I might have partially torn the Achilles, and then immediately, got an MRI as soon as we got home from Orlando. So, so just wild. But I'm healthy now. It's gone. Going to have to go back, do some imaging. And then, my plan is to just do all the things these naturopathic centers do moving forward, just to, I don't even use the word remission. My whole attitude towards it, I shared this with you all at dinner, was just more like, I never viewed myself as fighting cancer. I was just like, I'm thankful for this. God's given me a reason to do this. Like, I'm the CEO of a company that does early detection. I think I can tell this story and really embolden more consultants to put solutions like ours in the marketplace.
Yes.
Yes, it'll benefit Walk On Clinic, but I think it will, hopefully my story will really connect with some consultants that, know me or just know me on LinkedIn and are just like, okay, I really need to figure out a better primary care strategy for my employer groups, because if this can happen to Chris or Frank Mike Droppa, this can happen to anybody, And so, and if you get it early, you're fine. This is a bone cancer, guys. Like, this is,
right.
That's
crazy.
Yeah. Like, had I not gone and gotten the MRI and done the imaging, I probably would have played tennis for another year or 2 years. And had I not pushed it at the theme park and carrying my nieces and stuff with my two sisters, and it's just wild. I mean, I don't want to spend the whole podcast talking about it, but no. I just want everybody to know, if you're in a position to impact employees and employer organizations' lives, by helping them early detect things and giving them convenient access to primary care, do it.
Yes.
Do it.
And so, speaking of primary care, we know that, 85% of healthcare can be handled at that primary care level, right? So, let's talk through access, because this podcast, I keep looking like the business of benefits because we just renamed it, and I keep checking the TV. I'm like, what did we call my new podcast? Yeah. So when we talk about the business of benefits, right? The whole point of this show is to educate employers specifically. I'm sure there's consultants watching too, but HR, CFO, CEOs on the business behind their benefits program, right? And how to make smarter decisions. And let's shine a light on the shit that doesn't work and help everybody ask better questions to fix it. So obviously healthcare, health insurance for employers isn't really working, right? Yep. And there's a school of thought, and I believe in it. It's that primary care is part of the solution. So walk us through, set the stage for primary care, and then how do you solve for that?
Yeah. So I think it's important to know, I was a consultant for 13 years. I was a property casualty broker for Liberty Mutual first 4 years of my insurance career. And then I did benefits sitting out my non-compete at a small agency here in Orlando. That just got bought by another agency recently. And then I ran a captive. And I consulted to growing some agencies too. So that was my background before entrepreneurship, right? And the first account I ever worked before I was licensed was Rosen Hotels. I literally got walked right in the door, met their insurance agency. Provinsure back then was what it was called. Now I think it's called Rosensure. But I saw his on-site clinic model, and it always stuck with me throughout my insurance career. Now, what I identified kind of at the end of me, falling out of love or passionate with insurance was more, all of these employers are going self-funded, and nobody is really creating a model of on-site primary care that works for these employer groups that have multiple locations or that are smaller.
Yeah, can't afford an on-site.
Yeah, care ATCs, Premise Healths of the world. When I started selling insurance, it was, you weren't putting a clinic on site unless you were self-funded and had 3,000 employees, period, right? The math didn't make sense. The return on investment didn't make sense. And you still have a lot of that. You still have a lot of these large on-site clinic companies that have not scaled down their process to meet the patients where they are.
100%.
And that's, if you're going to be in the business of population health management or helping a consultant with a primary care clinic throw the pass where it needs to be thrown, you've got to be smart as a consultant on how you're managing that process. So we've seen the explosion of, direct primary care, right? But I've been saying for years, and I want to be clear. Everything is better than a fee-for-service model for primary care, okay? So I'm not bashing any of them. If you're a consultant and you're doing something other than fee-for-service primary care, good job, right? But I do want to make it clear that a near-site direct primary care clinic is not solving the entire problem of access for employer groups. Our first on-site clinic here was a call center. 80% of the employees took a bus to work. Okay, they were single moms. They're not. If you're asking them to drive 35 minutes somewhere and they don't have a car, they got to take an Uber, they're not going to go regardless of whether it's free. More importantly, there's 40 years of data from the National Association of Worksite Health Clinics that will show you that an on-site clinic most of the time has double the utilization that of a near-site clinic. So if you've got, 30% utilization on 1,000 employees, you got 300 employees utilizing a direct primary care clinic that's near site. If that DPC doctor was on site at that same employer group, you're most likely going to have 600 of those employees now using that direct primary care physician, just because you've eliminated the travel piece.
Right.
And that's been data that's existed for like 40 years in the on-site, near-site clinic industry. You can ask anybody from any of these on-site clinic companies what gets higher utilization, and they'll tell you. But I also think the consumer's driving a lot of that with just our culture now, ordering food to the house and being so lazy we don't go pick it up and whatever. So it's like, time is so valuable. If you can eliminate that factor and an employee can be on the clock while they're at work to access care, you're more likely to find somebody with a cancer tumor or a lump in their throat or something that's going to, you're more likely to save a life or impact a life or a family's lives if you're able to find a way to put the solution on site.
Yeah.
So
I think convenience time is certainly one of the big factors, but I know also the second factor is time of actual appointment. The average in the country is 7 minutes, which I think is an overestimation that people get with their primary.
Yeah.
And that's also something that you can kind of help. And because that, to your, medical situation that you had this year, it's probably not something that would have ever been talked about or diagnosed in like a PCP in 7 minutes.
No,
you know,
not a chance, you know, unless somebody was like, you know, we should get an MRI to check it out, you know, and then you have the shock. But to your point, getting an appointment, you know, some studies say it's 3 weeks, some say 6 to 8, depends on the market you're in. And I mean, hospital systems have bought up practices, turned them into mini ERs or urgent care centers. I mean, everybody knows, everybody's experiencing the same thing. Like, where are all the primary care docs? That's why I say there's a huge shortage of that. And we've had the discussion, and I've had it a couple times with people, but I don't think consultants understand that when they're contracting, again, it's a good solution, right? But this is a reinvention of the HMO model, okay? Like, it's a capitated rate. Somebody else is paying for it. Employer's paying for it now, right? Instead of the insurance company, or you're funding it through a TPA or an insurance plan, however you're doing it, right? But if you don't have control of that facility, you don't know how many employers they're going to contract with. And it's great to hear DPC docs all over the nation say, I'm going to spend 30 minutes to an hour with a patient. Well, not when, as soon as your practice is at 300 or 400 patients. Guess you're only going to do 1 or 2 in employer groups. How scalable is that? It's not. It's not, it's precisely why HMOs stopped working. Large organizations overcrowded those HMO primary care clinics, and you couldn't get an appointment. And then so the answer was, oh, we'll shrink the appointment time. We'll create more capacity that way with the doctors. So it's like, I think consultants need to, you know, if you're going to contract with the near-site DPC doc or an on-site clinic company or a company like Walk-On or any of them, you need to try and exert some type of control or parameters around, you know, how many employer groups that doc's going to work with until they expand. Because I hear all the time in my industry, in my space, we have 96% of our appointment slots filled, you know? Like it's a great thing. It's like a great thing. I'm like, that means 25% of the time an employee's calling to get an appointment and they can't get it because you've got a shared clinic with 5 different employer groups. So why the hell would you do it? If you're an 800 person employer group and there's a shared clinic with, you know, a 7,000 person employer group, I wonder how many appointment slots are going to be available for your 800 life group. And I wonder if they're always going to have access when they need it, when they've got a time bomb in their body, you know? I
think the other thing, and this happens a lot with our employers, is just multi-location, which I think is another thing that makes the DPC conversation very hard and something that's a little bit easier. So, you know, I had this discussion when we started doing DPC, and to your point, we're on the side where it's like, we're doing DPC, it's better than not having it.
100%.
But I had the same thoughts. I was like, well, all right, I know what the DPC fee is. I know what capitation used to be. I'm like, seems like the same number.
Yeah.
Right. And what happened there is they would just collect hundreds and hundreds and thousands of patients till you can't get a time slot. It takes 21, 22 days to get an appointment. So it's like, all right, that's something to look out for. But talk about your solution, because obviously with it being mobile,
Yeah,
you
can we time out and explain the bus? Because I'm like sitting here, I want everybody to visualize it. Because for me, that was the most impressive part when I saw it.
Yeah. Well, so I want to be clear here too, like we're an on-site, near-site clinic company. So we will build a near-site clinic at some point, and we have access to two in certain areas, through another partnership. But the reality is, like, the way I approach solving this problem was, how do we bring the access on site for all of these mid-market employer groups or multi-location employers? And the solution was, go to them. How do you go to them? Did they all have, you got to build out a clinic space at every facility? No, you can't do that. So we're like, we're going to put it in a mobile clinic. That's what we're going to do. So we built out 3 or 4 exam rooms
and a big ass bus.
Yeah. And and we pull it around to multiple different employers. So we have the ability to bring a, provider, MD, physician's assistant, nurse practitioner on site for these employer groups to do the primary care work that needs to be done. And we can be at one employer group one day and another employer group the next. But we kind of put a limit on the number of patients that our providers are able to see, so that the employees of these organizations always will have access to those providers. So my belief is, technology should be used to connect patients to providers that they know, not ones that they don't. You look at the failure of some of these private equity group like telemedicine pods, and I think Dave Chase just did a post on one of them. The reason they're failing is they're missing the human component of it. And so if you can take that great concierge medicine experience with a provider, and you can create that relationship between the employee and patient and that physician's office, everything changes. That they don't need a primary care doctor on site 5 days a week,
right?
Most employer groups, but they need somebody they can call when they need a prescription filled, and they need to know, oh, well, Nick's going to be here a week from now, or Maud's going to be here. These are providers of ours, right? Or Liz, like, they know, they have a relationship with their providers. They know who the medical directors are, and they know who to call when they need primary care. And then they know that physician will be there in another week, or will be there the next day.
I think there's like a misconception, Chris, and I'm guilty of it. Like thinking that, walk on is doing mostly vaccines or annual wellness exams. And that's not the case at all. The highest success of your program is when it's a weekly or a bi-weekly or what, And so speak to that. And then if you could also touch on data, I'd love to hear about that.
Yeah. So I would say that's been a failure that I blame myself for, right? So when I came into this, I was kind of like, well, I would never put a new vendor on my largest groups, right? So I wanted to just be able to say yes to brokers and consultants, right?
Yeah.
And so what I did by saying yes to the brokers and consultants in the marketplace was unfortunately also train the brokers and consultants in the marketplace that they could use this just as a wellness exam solution. Like, oh, I'll put this on my fully funded group. And I think people already have the subconscious programming of, oh, it's mobile, so it must just be an events thing. It's like, no. Like, this is how you increase the utilization for your employer groups by putting the clinic on site versus near site. And you have, double the utilization for your employer, which means you now have a quarterback throwing the pass everywhere else in your plan design that you need it thrown.
Yes. And just the impact, like, think about the financial impact for employers listening to this. Like, I think consultants already think about this, but HR, CFOs, the financial impact of catching a claim early, like your cancer, for example, now versus 2 years from now, the catastrophic difference in financial impact. So, okay. And then data.
On the data. So on the data. So I am truly proud of what we've built. We're going to be adding another component here soon, but like, that's another thing that I think we do better than anybody that competes in our space in the nation. And I will sit down with any broker or consultant and show them reporting from our clients. And it blows every direct primary care clinic, near site, on-site health clinic I've seen out of the water. And how we do that is we actually use the EHR system in our clinics and we tie every single CPT code to a Medicare rate, right? So our company's able to come in with a hard dollar return on investment report to the consultant and to the employer group of, here's exactly what these claims would have cost at a Medicare rate based on what happened in the clinic. I'm not assigning a $400 value per appointment for somebody that comes in and does a B12 shot or only sees a nurse. It's like, here are all the CPT codes that took place in the clinic that day. Here's what that amounts to dollar-wise. And then we take their own claims data and we'll put multipliers based on their past history of how much urgent care utilization they had or emergency room utilization they had, because we see those numbers go down immediately once we put the clinic on site, right? And we say, here were the billing factors, had 18% of your claims were occurring in emergency room or 30% of them were occurring at urgent care centers. Here's what that hard dollar number is. Plus there's some lab savings there. And then we also have a separate number that is the soft dollar cost. So here are the payroll dollars saved by you all not losing the employee for 4 hours of work time. And some companies are sophisticated enough where they have a production value of the employee and some aren't. So it's just a straight payroll dollar. But we let the consultants and the companies actually determine, to our own detriment sometimes. Like, I could go in there and do what every other company's doing, but I'm a former consultant, right?
So you're like, I'm going to customize.
Well, I know what I would want.
Yeah.
For my, as a former risk manager, I know what I would want. I think that's a key difference is like, I don't know of any other consultant built direct primary care practices, or on-site clinic companies. They're mostly, typically doctors or people from private equity world that are building these things. And we've built it kind of with my experience as a consultant in the beginning on like what would I want for my clients if I was still doing what you all do, and what I would want is to know the exact dollars that are saved so that I'm not, blowing smoke to my client on what I think the return on investment is. Like, no, here it is. Here's what your old data was. Here's the claims dollars. And sometimes that hurts. It's like, oh, well, you were 85% on the hard dollar. And if you let them decide. But when you have stories like ours, if you've seen Stephanie Kotz speaking everywhere at Hendry Marine, like, I mean, we've sent patients and saved lives at her company, just like mine was saved this year. It's a 300 life group. It's incredible stuff. But those employees aren't going to drive to a clinic somewhere. Yeah.
Well, I think estimating it at a Medicare rate's more than fair because we know they're not getting that.
Well, correct. So that's what
you could double that number and it would still be fair.
Yeah. Well, and we show that we use their own claims data if as long as we can get it.
As long as they have it.
Yep.
Right?
And we say, look, here's your total claims spent, and then here's the dollar amount we're going to sign it up. We will put multipliers on, what the former hospital utilization was and that. But we still break out the numbers on their own so they can see it. And it's like all the data gets kicked out into an Excel file. It prints out a beautiful report, but it's as honest and transparent as it could possibly be. And nobody else is doing it that I've seen in the space, So
I love that.
We like it. We've used it.
Mm-hmm.
We followed your journey, and I agree. We fell in the same trap, thinking of it as a wellness, a flu shot.
It's my fault.
Don't
listen,
it is your fault.
I'm going around conferences singing and having a good time instead of telling people how serious and good this stuff can be.
Yeah. No, I mean it works. It's on-site clinic to the frequency the business needs. So
that's the other thing, fractionalizing it.
Correct. So we heard about how, you go from 1 day to 2 day, as the need builds.
Yeah. Whatever the claims data supports.
Right.
Let's look at the claims data and let's make an educated decision on what's going to generate a positive return on investment for the client.
Right.
So like a little timeout, because I always just want to make sure that our listeners, especially like HR and CFOs, like I know if consultants are listening, this is all making a lot of sense.
Sure.
For employers though, this is what we mean when we talk about data-driven decision making, right? So like when we talk about a benefits business plan, like you can't make a business plan. You can't know how many times you need a mobile on-site clinic. You don't know if you should be doing your pharmacy through your mobile on-site clinic. You don't know what types of things you need if you don't have data.
Yeah.
So like step one in every type of like innovative program is like get access to data. And then when you pick vendors like Walk On Clinic, and if you're going to vet some other ones, look for their packages, their data packages, and vet the crap out of them, because everybody says they have data and actionable data and they know what to do with data, and it's not true. Like, but it sounds like your data's legit.
Yeah, I mean, well, if somebody's got a better way, like I'm always open for improvement. I'm not saying
Yeah.
what we've built is perfect. I'm just very proud of the reporting that we can provide consultants and employers comparative to the marketplace of companies that are much larger than us, and so we're good. We've had a lot of, we're a multi-million-dollar company now,
Let's
so
go.
I'm very happy to see that growth. And I just think, I want more employers and consultants to kind of take this journey. If you're watching the news and you're watching X or Twitter feeds or whatever, you see what's going on. It's just, how do you make the decision? And to your point, you can't make the decision if you don't have data.
Yeah.
Overall, removing the fee-for-service model, the model where they get paid for every treatment they can ring up, and going into something that's more care-driven, outcome-driven to kind of reduce that claim spend.
Absolutely. Well, Chris, we are so glad you are with us, literally.
Thank you. Me too.
Oh, man. And I really
Me
feel
too.
like your new story is going to just continue driving and success for your business, but just so much impact. And I know that that's really what your ethos is and what you want in life.
Yep. That's my game plan. And you will have a Moffat Man, Elton John, Rocket Man song parody coming soon.
Let's go.
I took some footage, tried to stay in good spirits throughout it. So that one will be dropping soon. I need to do Marty's new book too. And there's you see a lot more of Mike Droppa
Awesome.
in 2025.
Well, we're excited.
And Chris Yarn. So
That's
Who's
good.
he?
yeah. At least Spencer was smart enough to completely separate the two.
Yeah.
So,
No, everyone's just confused now.
he only has one LinkedIn profile.
All right. Well, guys, thank you for listening. Don't forget to share, like, subscribe. Walk On Clinic is absolutely incredible. So for the consultants listening, if you haven't checked it out, check it out. Employers, you can do that too. You don't have to wait on your people to bring you things. When you hear amazing stories like this, check it out. Be an advocate for yourself. Ask better questions. Thank you for tuning in. We'll see you next week.